So the first thing we're going to do is we're going to have Paige Ellis talk to us a little bit about uh, what the city's doing, what the status is for the COVID-19 situation. So, Paige, you want to unmute? Take it away. Oops.
Sure. Can everyone hear me okay?
You're really low. I can barely hear you.
Does that help at all?
Yes, that's better.
Okay. We'll go ahead with that. Very exciting to be first up in the meeting. I know this is a really uncertain time, so I want to do my best to provide you the information that you need. This is obviously a very serious situation. It's very, very important that everybody continues to stay home as much as possible. I know it's really difficult. We're about 3 weeks in from teleworking, and I've had a few moments where even I am going stir crazy. So I just want you to know that as much as this is really intense and not normal for humans to try to behave this way, it is extremely helpful to our hospital workers and our first responders and our people on the front lines who are operating our grocery stores to continue to do your social distancing, stay home as much as possible. If we can really, really keep this at bay as much as possible, then we will be able to get through it a lot quicker. If we start to relax and not follow CDC guidelines and not follow city guidelines, then we could end up having to go through this multiple times. And so I really want to stress the best way to help right now is to stay home and stay further away from people, as much as I know that's very difficult because we all miss each other a lot. As of right now, the state of Texas has 6,812 cases of coronavirus statewide. And right now, 460 of those are confirmed to be in the Austin-Travis County area. And we have gotten to a place where the CDC is advising people to wear face masks in public. I know that's kind of shocking and a little bit frightening, but it really is the way that we show how much we care about our community and the way that we're going to protect each other. So I would take that advice very seriously. Sorry, my cat just fell off the desk. These things will happen. So how can you help? The biggest thing, like I said, is stay home. Another big thing that you can do is donate supplies like personal protection equipment. If you have any face masks that you have in a closet somewhere that haven't been used, please connect with someone. The main recommendation is the Austin Disaster Relief Network. There are a number of other ones. I know that the Oak Hill United Methodist Church has been collecting PPE. I'm sure a number of you have other recommendations on where to get those to the best people. We are looking at a situation where our healthcare professionals need our assistance there, and we're trying to make sure that we can protect them because they're on the front lines. And also donate to a cause. I know there's a lot of other things that we care about in this community. The Other Ones Foundation has done a fantastic job. They now have mobile hygiene stations. They have showers and restrooms that they are going to different places in the city to assist our neighbors experiencing homelessness, which is amazing. I think they just got extra hand sanitizer from Tito's Vodka. So it's really great to see all of our community partners stepping up, but they are trying to assemble food kits and supplies so that people who are the less fortunate among us and the most vulnerable are not forgotten during this difficult time. The Central Texas Food Bank has asked for a lot more donations. So if you have any non-perishable items that you're willing to part with, I strongly recommend that you share with them. There are a lot of people out there right now that are needing to access the food bank that are either doing it more often than they used to, or they never used to, and now they have found themselves in a position where they need our help. The musicians who first we thought, were going to be just South by Southwest was canceled and a lot of gigs were going to be canceled. Now it has turned into a much longer game plan, and we have a lot of musicians that need help with Band Together. There's a GoFundMe that they are trying to help our musicians and our service workers. A lot of our restaurants have very quickly adapted to this situation and are offering takeout. I actually have a Google Maps link that I'm going to have up on my Facebook page if you want to check it out. But these are our local mom and pop shops. These are our Austin local favorite restaurants that need help making sure that they can keep their bills paid and that they can keep their employees taken care of during this time. But I strongly encourage you do the pickup. I strongly encourage you try to support them, but make sure you're washing everything down, you're wearing gloves, and trying to make sure that we can keep this virus going incrementally the way that it has been. We're really, really trying to flatten that curve. And also mobile locations is a great resource. They are delivering meals to seniors, and they've tried to adapt their plan into something where they can do fewer deliveries that will be able to be refrigerated or frozen for longer. So those who can't get out and go to the grocery store, takeaway, still have an option and can have healthy eating during this time. How to stay sane while isolating at home. Go for a walk. I know there's a lot of controversy around our parks and our trails right now. The Barton Springs Spillway has just recently been closed. There were just too many images of people hanging out like there was not a viral pandemic going on. And it's really unfortunate. We want to trust people to social in public. And I really want to make sure that people have access to nature. This is a really hard time to be cooped, but you really need to keep your distance. And if you are out and you see people congregating and they are not keeping their distance, call 311 because they are tracking this. They will send someone to go investigate that situation. And there will be fines assessed for people who are violating our social distancing rules, because that's how important it is that we take care of each other right now. You can do Zoom happy hours or Zoom coffee or whatever it is. Make sure you're calling your neighbors, FaceTiming. Try to live as much of a normal life as possible digitally. And that's a good way that we can stay connected and stay sane during this difficult time, connect each other to the or the donations that people need, whether it's food or monetary, and really, really look out for each other. As always, check in on your neighbors, make sure everyone's doing okay, and wash your hands, wipe everything down and disinfect everything all the time. And we can show what the Austin community is all about, which is looking out for each other and trying to get through this together. So that's all the notes that I had right now. I'm not sure if there's anything more specific that you address. There's a lot of moving parts, and so I'm trying to keep people up to date as much as possible, knowing one day a city has a rule, the next day the governor comes and changes things. And so we're all trying to be collaborative to put out the information that we have, even though sometimes it changes very quickly. And just let me know if there's anything that you need from me, and I'm happy to help with anything that you might possibly need.
So Paige, I have a couple of questions that were submitted. One, which is actually a pretty good question, which is, can you give us an update on the testing? I know we've all heard, anecdotal things about someone having symptoms and not being able to be tested. What is that situation as you know it right now?
It's been very difficult for us as council members to be up to date on the testing situation. We know that as the federal government has been issuing its orders to make sure that, we are reassessing our production methods and the information that's necessary to get those tests in people's hands. It's been very difficult to know when the next batches are coming. That's the most difficult part of testing, is if you knew I have 1,000 coming today and I have 1,000 coming next Sunday, then you would be more likely to test people that are showing symptoms, not knowing how badly it's going to affect them. And without knowing when future batches are coming or how many are going to be coming, that's why the medical director has had to be very, very tight with who gets a test. That's part of the quarantining at home, is that you may be experiencing symptoms, but they're more mild, and they're trying to reserve tests for immunocompromised or older people, because that's what the global trends were showing was going to be necessary. What's actually surprising is that we're seeing people between 40 actually having more of this. And so that's not something that I think we see nationally or across the other parts of the world. But I agree, there's not coming out about how many tests are available and where we need to draw the line to be able to get people tested as much as possible. It's a huge concern, and it's something I keep asking for updates on. And there's just not enough information, which is extremely at this time.
Mm-hmm. And I guess we've also seen where the governor has overridden some of the local, stay at home kind of measures. Can you bring us up to date on what that is?
The newest governor's order is actually kind of interesting because he refused to use the word stay at home, even though it was obviously a stay at home order. I do not understand this. Maybe it's just a matter of his politics. There was maybe 2 weeks ago or a week and a half, he said, it's not necessary, it's only the big cities and the big cities need to deal with it. Well, now over half of Texas's counties are showing cases of COVID. So it obviously wasn't a very good statement. It wasn't a good policy. I didn't agree with it. And now that we're seeing over half of Texas counties showing at least one case, he's changed his mind and realized that people do need to be social distancing. They do need to be staying at home and teleworking if at all possible. One interesting thing in his most recent order, which was very odd, we were trying to navigate at the city level what to do about construction. And you oftentimes think of construction as, is this necessary critical infrastructure? Is this a matter of someone is building a home and there are, aspects of that may not be as urgent as other construction projects? I actually had constituents who were left without a kitchen sink, with a pool that had exposed rebar, that the crews, wanted to be cautious and just packed up and left. And so we were trying to fight for our constituents that were in the middle of a construction project or trying to move into a new home. They were leasing back the home that they had just sold. And there were a lot of people stuck in this middle ground. And so I kept pushing for more clarification and arguing that plumbing is a necessary critical infrastructure when people are in place. And then the governor came and said all construction, which I think is a little too lenient. So there's a lot of back and forth and a lot of calibration that's happening. I'm glad that some of these constituents who were left in situations where their kitchen wasn't fully functioning or a bathroom wasn't fully functioning, that those could be rectified. But I don't think that every single aspect of construction is absolutely critical. I think we need to be very smart and calibrated to make sure we aren't inadvertently infecting construction workers too. So there's a lot of moving parts with it.
So circling back to your statement about the parks are important. We're very lucky to have such a wonderful park situation in Austin and the ability to get out into them. How are you going to balance that there's too many people, acting too cavalierly? Or how do you control the golf courses? We're getting those kinds of questions on the chat. Can you walk us through the decision making, and then what is the status on the golf courses?
So right now the golf courses are open. A lot of the parks that have gates or parking lots have been closed. The trails are still open, and some of the swimming holes have been case-by-case basis. The Barton Creek Spillway has been closed because it was just too much of a risk, while the Hill of Life and Lost Creek remain open. Obviously, we just had a bunch of rain yesterday too, so I think people are avoiding areas that used to be, pathways that you could cross that are no longer safe to do that on foot. But it is a difficult line of, do we just shut everything down? Or do we see if people can keep their social distance and follow all of the other rules and keep each other, active? People need to go for runs. Dogs need to go for walks. It is a great relief to the soul when you actually get outside your four walls and go and breathe some fresh air. But if we get reports that golfers are not social distancing, people are going to swimming holes and they're not being separate, like families that are being many, many feet apart so that if anyone sneezes or coughs, they're not infecting each other. But we've tried not to disrupt normal life until it is shown to be absolutely necessary for health and safety of other people. The trails are going to be hard to close because a lot of them don't have gates. But like I said earlier, if you see anything where it looks out of place or you're seeing, someone's throwing a party that shouldn't be, you should call 311 or even 911 if you see something that really, really is a threat to somebody's health and safety. We're trying not to be too strict too early, knowing this is, but we absolutely have to keep people safe in this city.
So one of the things I've been reading about in New York is just the toll this virus is taking on first responders and how many are out currently. What are you guys doing to safeguard our first responders? I mean, that's really scary if you do have an emergency and you call and you can't get anybody, or everybody's sick, or, how are you guys preparing for that?
Yeah, we're definitely making sure that the personal protective equipment is first available to our first responders and our hospital workers. We do have a couple cases of an EMS employee coming down with it. It was actually just announced recently that a mechanic for Cap Metro had it, in contact with the public. But first responders and others on the front line, like our healthcare workers, are absolutely our number one safety priority. And the medical director is handling the communications between different hospitals and different physicians' offices to make sure that they all have a game plan. That is something that where council's advice is, we like to help in every way that we possibly can, but sometimes we have to understand that medical directors need to be making medical decisions, and we don't necessarily need my input on a hospital's emergency operations planning. But we absolutely are putting number one our first responders and our hospital healthcare workers to make sure that they have that protective equipment. And I believe they're getting access to a test if they are showing those symptoms, because there is a higher likelihood that they could be passing something around, or that we could identify a situation where they contracted it, and to be able to identify how to stop that from further spread. So they're absolutely our number one priority, and I really appreciate all of the work they're doing, because I know that really giving it their all, and they deserve all of our support.
And then one more question, Paige. I appreciate you taking these. I know that, you have as much information as you have, so we appreciate you at least giving us some information, which is a little bit further down the line. Frankly, I don't even know if you've had a chance to think about this, but city budget and city income, are we concerned about that yet? Should that even be on our radar?
It is absolutely on my radar. I actually just had a post on the message board recently, because I know a couple other council members pro tem for emergency funding for their constituents who are really in a tight spot, or have lost their job, or don't qualify for some of the federal care. But we absolutely need to understand the repercussions of the financial repercussions. Canceling South by, understanding lost sales tax revenue, how that affects public transportation. We have done an emergency, I'm forgetting the exact language, but at our last meeting, we created an emergency fund through economic development, and that is gap funding to assist until the federal SBA loan can come through, because that takes a few weeks for people who are going to receive that to actually start receiving that check. So I know this is going to be difficult, and it is very hard to make decisions between how much money do we have and how much money is it going to take to get some of these operations back up and running. We are going to have those conversations either at the work session on Tuesday, or in a briefing at the council meeting on Thursday. And so I know that we've asked for that, and we really need to start putting the pencil to the paper and looking at what can we readjust, and what are all of the needs of the city right now, and understanding how that's going to work. This is not going to be an easy task, because of course we all want everything. We all want to take care of everybody, but we have to be very realistic about a city's budget. And I foresee budget amendments coming, because this just isn't something that's going to work with what we had in September, which was not that there was going to be a global viral pandemic. And here we are, and we're going to roll up our sleeves, and we're going to take care of people, and we're going to have to make some somewhere.
Okay. Well, thank you so much for joining us. I really appreciate your time, Paige. And I know that you're doing your best. We're all doing our best. And it's so nice to be able to speak with somebody who really knows what's going on. So.
I appreciate it. I'm doing my best, and I do updates on my Facebook page, which I know I'll share into Blue Action. Sometimes you'll pick it up and share it. And so I really appreciate that. We're just trying to make sure everyone has all the information, and we're going to get through this together. We just have to look out for each other.
Great. Thank you again. So I think we're going